Hereditary hemochromatosis. It is an autosomal recessive disorder affecting HFE gene, which is present of chromosome 6. It is a disease of iron overload, and the mechanism is increased intestinal iron absorption. Normal physiology of the iron regulation is via shutting of the intestinal absorption, and this is impaired in the hemochromatosis patient. Body has poor ability to excrete iron. Otherwise, there are minor losses via skin shedding, but as such, the excretion of the iron from the body is very poor. Since women excrete naturally via menses, presentation occurs earlier in men. Uh, this can present with the bronze diabetes, and that is because of the hyperpigmentation, which is due to hemosiderin deposition in the skin, and there is increased fasting glucose levels, and that this is because of the iron deposition in the tail of the pancreas. The other findings could be infertility due to the deposition of the iron in hypothalamus, anterior pituitary, or the gonads. It could also cause cardiomyopathy leading to cardiac arrhythmia or the cardiac failure, or it can also cause arthritis, and we call it as a pseudogout. And if you are preparing for USMLE, you want to know that there is increased risk of hepatocellular carcinoma in patient with hereditary hemochromatosis. The diagnosis for the hereditary hemochromatosis could be done by the measurement of the ferritin level in the serum, which is usually greater than 300, and transferrin saturation will also be increased. It is extremely rare that the ferritin level more than 100 is present in any other condition. If we talk about the USMLE part, there is a high amount of ferritin is usually associated with hereditary hemochromatosis. It is treated with serial phlebotomy and not the chelators. Though for the hereditary hemochromatosis, the treatment of choice would be serial phlebotomy. And let's talk about the chelators. The chelators such as deferoxamine or the deferoxyrox are used in the secondary hemochromatosis, which is due to usually transfusional siderosis, that is repeated blood transfusion that contains iron. So for example, if a patient has beta thalassemia major and it requires repeated blood transfusion and it contains iron, so this is what we call it as iron overload state, but it is not hereditary, it is secondary to the transfusion, so we call it as secondary hemochromatosis. And to treat the secondary hemochromatosis, we use the chelators. But for the treatment of hereditary hemochromatosis, it is usually serial phlebotomy. Thank you.